For most women, your annual checkup, whether it's a gynecologist or your family doctor, usually includes a pelvic exam.
Well, now the American College of Physicians says that healthy adult women who are not pregnant can skip the yearly exam. It's a recommendation not everyone agrees with.
My name is Felicia LeKay, and on December 2nd, 2013, I was diagnosed with ovarian cancer. I led an extremely healthy lifestyle. I was starring in Motown the Musical, playing Diana Ross on Broadway, and I wasn't having any symptoms.
At just 34, Felicia went to her gynecologist for her annual visit. During the pelvic exam, her doctor noticed that a cyst on her ovary that was first detected during a previous year's exam had grown larger. It was eventually confirmed to be ovarian cancer.
Knowing how small it had been initially and the growth that it did within a year's time was very significant. The first time I had a pelvic exam, it was uncomfortable. I will tell you, it's not the worst thing in the world. It's fairly easy, compared to what it could be.
Felicia, who is now cancer-free, is featured in a PSA encouraging women to be their own best health advocate.
To know your body is really the most powerful gift that you can give to yourself.
Dr. Tara Shirazian is an assistant professor of obstetrics, gynecology, and reproductive science at Mount Sinai Hospital.
And Dr. Ranit Mishori practices family medicine at Georgetown University Medical Center. Welcome.
Hi, ladies. So you guys are on opposite ends of this kind of controversial, I guess, ruling or decision that came out today. Tell us your points of view. Why do you think people should continue to go?
Well, I think one of the most important reasons that pelvic exams are important for women is that it gives us a baseline sense of a woman's sort of anatomy each year when she comes in. So, for example, if I do a pelvic exam one year, if there are changes from year to year, much like you just heard in the prior film, I'll be able to feel it and I'll be able to detect new findings like fibroids, ovarian cysts, pelvic pain, sexual dysfunction, incontinence. The list is lengthy.
So it makes sense.
But if she hadn't gone the next year, this young woman perhaps would be gone.
This is a terrible story, but I could have brought you another story of a woman who had a finding that she went on to have surgery and she had a lot of complications. So there are harms to these exams, so they should not be discounted. The number of women who actually have pathology that is meaningful clinically and that will save their lives if we find it early is very, very, very small.
Well, yeah. And actually, to that point, the guidelines actually mention just very few studies on this at all. So really, there's not a lot of data looking at pelvic exams in women and the long-term consequences of what's been found. So
I have friends who would be gone if they had not gone for a mammogram, for their annual exam. Dear, precious friends. And to me, those statistics mean nothing that you're talking about if it's somebody you love. It's your mother, it's you, it's your best friend. So I think this is all about money. That's my personal feeling about it.
I agree with you. I don't think it's about money, but I think when it's your mom and it's any individual, this is a terrible situation. However, we can't make clinical decisions based on anecdotal information, based on a story here and a story there. Those people who did the study, they looked at 60 years worth of studies. There are not a lot out there, but there are plenty. They looked at more than 52 studies.
Yeah, but there were 0 studies on benign findings on pelvic exams, so fibroids, cysts, et
So the downside, I mean, we were reading about the downside. They say, number one, it's costly. Number two, it's uncomfortable. It seems like both of those things are sort of a yawn. Now, if you end up getting a diagnosis for something that isn't, and you do surgery you don't need, and then there's an issue as a result of the surgery, you sort of see that issue. But what are the other, why not, really?
The thing is, there's not much you can really find on the pelvic exam in a woman who is completely asymptomatic. She has no symptoms, so no bleeding, no discharge, no pain. The things that you can find that actually, if you find them early, make a difference in extending her life.
But that's the point, finding it early.
And not only that, I don't agree with that. I have many women in the office who have no complaints when they come in. They don't vocalize any issues. and I will find benign things, possibly, or just findings on their exam, like fibroids, and I'll say, oh, do you feel this? I can feel you have a 5-centimeter fibroid. And she'll say to me, oh, I just thought that was normal.
Yeah.
So it's an important part of education, counseling, and preventative
Do you think
health
it's going to change anything? We just have a couple of seconds. Do you think this is going to change
I hope it changes some of the practices. I think this is a ritual that is not evidence-based, and I hope the practice changes, and I hope we get to do fewer pelvic exams.
And you
Can I ask one last question? How many pelvic exams do you do as a family practitioner?
Thousands. I deliver babies as a family doc. I do thousands of pelvic exams a year. And honestly, she says she finds a lot. I don't find a lot. But listening to her and listening to me is not the point. The point is listening to the science and the research and the evidence that's out there.
And you said there needs to be more research.
I think there needs to be more research. There's
Thank
not
you,
good
ladies,
research.
for
the
healthy
debate continues.
Yes.
Smart ladies. All right, thank you. Thanks so much.